Many people are shocked to hear that pastors are facing mental health issues as a result of COVID. There are millions of people who turn to pastors for help. Joining me to talk about this are Dr. Roger Ball, a pastor, a school administrator, and a professor at Fordham University, and Bishop Dr. Barbara Austin Lucas from the Agape Tabernacle Fellowship Church. Welcome to Brooklyn 45. Let us begin by talking about this vexing situation, mental health affecting COVID pastors. Let me begin with you, Dr. Ball. How do you respond to that?
That is a critically important question for so many of us pastors today who are really essential workers on the front line. What we see is that all of the things that we hold near and dear, the rhythm of life, the flow of church services, all of that has been upended as churches have been closed, pews remain empty, doors boarded up. Some churches have even gone under, and this is impacting pastors, even as they themselves have contracted the coronavirus, the many funerals, hospitalizations within their families and within their congregation. It would be probably impossible for pastors not to be impacted mentally, the mental health not to be impacted by all that has gone on. And so this pandemic is pervasive and none is exempt, including pastors.
Bishop Lucas, how do you respond to that?
Initially, I had a lot of issues because I did not feel as if pastors were being treated as first responders, to be very honest with you, because I believed that if I had a parishioner, if I had someone who was going through, I ought to be able to make a decision to see them. If I put my PPE on, I should be able to allow them to hear a pastor's voice and to pray, not just with family members who were going through, but with people who were in the hospital and had to die alone. There's something very ethically, I had a problem as a minister, and I voiced it to many politicians to the point that I even asked the question, did they have the right and did we have to respond in the manner that we did? And for those who were honest with me, they said no. We simply complied with a request. It was not that we had to honor it. So I have been through this, finding a way in which I could respond, trying to find ways in which I could be in the place where being present is a part of what we do. So not being present, how do you become present? How do you maintain? So for me, I never stopped going to the church. There were empty pews, but I still went and I preached as much as I could from the pulpit.
Are you aware of any pastors who have suffered mental health issues as a result of COVID?
Yes, that's the short answer, yes. Because, and I think what I did was helping me, all right? It's a strange way. But I had to keep going to the church to help me. I had to be in the place where I understood that I may not be able to get to the people the way I wanted to get to them, but they had to see that I was still in the role and I was still trying, even through social media platforms that we utilize, Zoom being one, conference calling being another, being in that place where possible, we were in touch with youth through Facebook and other pieces of social media. I mean, we had to do the best we could with whatever we had.
Dr. Ball, what are the positives that churches would have seen from this COVID situation?
Sure, if I may, but before I respond to that, if I could just go back quickly on one point there, and that is, pastors' mental health is also their spiritual health. And during this time, so many pastors, our sense of God's presence is when our lives seem to, is holding. And in some ways, many pastors are asking, where is God? Where is God in all of this? And And we could yell at them and we could say that, how could you have lost faith during this time? But there's just been so much death, so much suffering, unprecedented, including pastors' families who are succumbing to this virus. And so this thing is very, very real in terms of, which is why pastors need others as well to really support them. Particularly to the second question that you just asked, every crisis is also an opportunity, even when it's awful. And so one of the things that we've seen is churches are now, at least for those who have really moved quickly or who were advanced already with their technology, social media, broadcasting on the World Wide Web, we now have been able to reach a larger group of people than we have ever reached. That's one thing. And so, but those who fail to really change and innovate will succumb during this time. Others, like my local church, for example, we are now feeding more people during this pandemic, whereas last June, we probably fed about, 1,000 people for the month of June. Now we're feeding thousands and thousands of people every month. And so we're forming partnerships, new partners. So churches during this time really have the opportunity to expand, in my mind, what I call to do some serious ministry during this time, to meet the needs and to remind ourselves that church itself is not the four walls, but the people of God remains the active church. And so whether in a building, outside of a building, this is also a time to innovate to meet the needs of our congregants.
Bishop Lucas, a question that comes to mind is, who do pastors turn to in situations like this?
I think the first thing for me, when you talk about the positives, I've talked to so many ministers who said that prior to COVID-19, they were tired, they were overworked, in a sense. They didn't realize how they could get the rest that they needed. So in a real sense, I came to understand through this process that God had given us a sabbatical, that God had given us Sabbath, a time of rest. And in the midst of it, personally, I realized it wasn't so much what I was doing for God, but Pete Scazzero does books on spiritual maturity and being able to understand responsibility as a person of religious calling, to be in that place where you're not so much doing all the time, but that you are present and being with God. So I took it as an opportunity to, first of all, do it myself. And I said so often to disciples, I said, if I could give everybody a vacation, I would. If I could pay for you to go somewhere, I would. But what I saw through the self-quarantining is that it gave me time to be alone and to hear God. It gave me opportunity to read my word, and nobody was calling to see where I was because they knew where I was. And then people taking the time to check on you. And I mean, really check on you, because there's nothing really that you could do for them other than to pray and the other things that you do. So we learn how to share the burden. I said to them, just like you need, I need. And we're in that place where we have to care for and with each other. And that's what I tried to do.
Yes. Dr. Ball, my same question to you. Who do pastors turn to in situations like this? I mean, Bishop says that she's self-quarantined and she was able to get to God in this space of aloneness. Who do pastors turn to?
Donald Capps, in his classic work, Agents of Hope, talks about allies of hope. And one of those things he says is reliable others. Reliable others in your life. It's Ruth who had Naomi, and Joshua who had Moses. And so whom do we have in this time? It's really a critical question, because I think in some ways we as pastors have really been taught to bear our own burdens, to you know, to hold it inside, to carry on even when we're dying inside, even when we're barren and empty and there's nothing more, and we're speaking the word, but we're not really being benefited from it. And during this time of COVID, where you have so much suffering, including for pastors, depression is up on the rise, domestic violence is on the rise, divorce is on the rise, pastors' families are becoming undone. The questions of who pastors turn to, I think, is a pressing one. And so I would propose, so here it is, right? If pastors didn't have any reliable others in their lives to turn to pre-COVID, there's a very good chance that when they are in the middle of drowning, they might not have anyone to turn to. Thus, the depression is on the rise. And so I would say up front to begin with, that we need each other, right? Pastors need other ministers, a cohort, a professional support that is not your congregation, right? But someone who may be removed a little bit from your local church, that you could really sit down and say, listen, I have to tell you something. My brain is just not working. I'm struggling with my faith. My marriage is in the balance. My kids are going crazy. And I feel like throwing in the towel and to really be ministered to.
And pastors are saying that as well.
Pastors are absolutely saying that they feel capsized by this pandemic, and so we need each other, right? We pastors need each other, and so I can't stress the point enough that those marriages, or for example, pastors' relationships and pastors' struggles, if they did not have the infrastructure that support before, what we're seeing right now is that some of these pastors and their relationships are collapsing, and it's no need to pass judgment, right? There's absolutely no need to pass judgment. It's simply to say, how do we provide them the support so that they could outlast this pandemic and to go on to do God's work?
Okay. So Bishop, how do you provide support to others, to your congregation, when there are restrictions that say you can only have so many people in a church, and there are so many people who are remaining at home, and not everyone has access to the internet. Not every church is providing internet services. How do you provide support to your congregations, and how do pastors provide support to their congregations?
Well, one thing that Reverend Dr. Ball brought up that I just want to say, there's always been issues in pastoral families. We need to understand that. Domestic violence has always been present, and perhaps ministers have been among the worst perpetrators of domestic violence, and that's documented. The issue is, in the midst of this pandemic, in the midst of COVID-19, it's difficult to hide. I think, and even though it looks like you're not out there, it's difficult to hide because people understand, first of all, that you are going through. They know it, because we lost in Brooklyn at least, I believe they said 35 ministers, at least, and I mean 35 pastors, okay? I was discussing it with a friend of mine in Connecticut, and from one denomination, they lost about 30 bishops. So it's like, I don't know if we understand the level, the depth of the loss that has occurred in certain denominations, but it's there. I was doing some teaching at Megger, actually, and it was towards March, just before they said they would not meet in classes. And it was one student that because we had to continue the classes online. And the student said she had lost at least 3. Her husband was a pastor. She had lost at least 3 other family members and friends who were pastors. And so what did I do? I just had to, kind of stay there with her and not try to talk her out of the pain, but to stay there with her and let her understand that I heard her, first of all. And if she needed to talk, that I was present if she needed more. But you can only talk about what people are ready to talk about. So what did I do? We have, and people do this in various ways. Like either the Methodists have classes, certain denominations may have what they call clouds, others have groups, small groups. But what I started to do is to activate the leaders of the small groups and to say to them how important it was for them to function, to check in with everybody, you know, at least on a weekly basis, and if they could more, to be in that place where they would pray with them. You don't have to get into folks' business, because that's one of the major things in the church. People don't want you in their business. So if you are not in that place where you're not asking them questions, not trying to be evasive, and you're not trying to be in that place where you intrude, but you want to know how they are. And that's all I ask them to do, is to be a representation of myself in the midst of the congregation and amongst other disciples, and to know that to the best of my ability, I would try to be there for them. But they had to understand I was going through too. So in the midst of it, I lost an aunt in another state, but I couldn't go. So we had to deal with a virtual funeral. Then the Lord spoke to me clearly about the need to act responsibly. As I look historically at the church, many of our churches and denominations, they became well known in the midst of crisis, in the midst of the yellow fever pandemic. They were out there in the streets. They were ministering. They were doing the mission work, taking care of those. This time, the church was prevented from doing that en masse. You had to be very creative to be in the midst of offering your services in this pandemic. So I don't know if it was intentional, but sometimes I felt kind of that way, to be honest.
No, if it's intentional, it's from outside.
Well, I'm just saying, what I'm saying is that there was an intentional decision in terms of who would be the first responders. Because they easily could have said that pastors are in this group as well.
Mm-hmm.
They easily could have said that. And given the preparation that was needed in terms of personal protective equipment, given it freely initially from the beginning, and then told you to be in a place where you acted responsibly. The people could not see us as first responders because the overall culture outside did not see us as that. That's all I'm saying.
Dr. Ball, how do you respond to that? I have another question for you, but do you have a response to that and add on?
Well, here's what I would say, right? I would say that there is a place, and I sat on the governor's advisory council. I was one of about 40 ministers in New York State that was appointed to his advisory council. And so we provided feedback, and there was a lot of, to Bishop's point, there was a lot of pushback, even in, you have churches and synagogues and mosques that host and hold 4,000 people, and they were saying you could only have, 10 people in those spaces. And so this one size fits all, raise serious questions. So I think there's a place for dissent in terms of the way it is shaped up, and I'm good with that. Vive la résistance, as the French would say, to live the resistance. So I think that there's some, pushback is good.
Mm-hmm. Let's get to the people that you serve. Bishop talked about some situations with family members and church families as well. You train social workers. How do you use this in the church itself?
Well, all pastors are social workers, is what I would say. We're all social workers. We're all doing God's work.
Bishop said all pastors are first responders. You say all pastors are social workers.
And social workers are first responders.
And so I would probably say up front, so, to a question that you really asked around, there is something to be said about that is now different. It's different, but we can still meet in small groups. We can still have conference. One of the things I've done in my church in being intentional, like my elderly population, is get the younger generations to get them up on Facebook, to activate Zoom's account for them so that, and phone conference line so that we could, in some ways it's different. We're further apart, but in other ways, we're much more closer in terms of those small and more intimate studies, prayer meetings, groups, encouragement. But it's different. We're no longer together as we have been historically.
Okay, and social workers, responders, how do you help your church members who have become unemployed because of COVID?
Yeah, so one of the things that I have said initially is that we have formed, my local church have formed partnership. So any given week, we are serving literally hundreds and hundreds and hundreds of constituents and congregants and community members, more so than any other church, frankly, I've seen in my community. So that's one simple ways that we have done it, is to make sure that there's food on the table. And so whether it's with ShopRites and Targets and the Food Bank of New York and partners and businesses who come to donate money to really help us to fund a food bank that in some ways is on steroids every week.
Mm-hmm. Bishop, what can churches do to prevent themselves from closing during this pandemic? You said many pastors have died, but are there churches that have closed because of the pandemic?
I think that there are churches where they didn't have the layers of leadership. If everything was on that one person, that one pastor, and they did most of the work, then I believe they will probably be more prone to saying there's no one else. And other ministers, they wouldn't necessarily say, well, I'll come, I'll do it. They would have a harder time unless they were connected with a denomination or a group of persons who could readily put someone in the place of leader. So if it was a one person leadership pattern, then it was probably more difficult. What I felt, and even in terms of going to other places of worship before it broke out, the funeral directors were front line. And what I will say is that I had one funeral director just say to me, call me late and say to me, the leader at this particular church that they are having this service at tomorrow has just come down with a fever. And the custodian is not working. and I'm saying, what do I do? And as I prayed about it, and other people began to say things to me, and that is my children and other persons, they were saying, you have to protect yourself at this point, because we didn't know how to protect ourselves. And so as I prayed about it, I just heard God say, be responsible. And I think sometimes we won't necessarily think about ourselves, but we'll think about the other people around us, and being responsible meant that I had to ask certain questions. So if that leader had come down with a fever, I know that was then the telltale symptom, all right? If that person was being quarantined in their own home, then what was that saying about the church, the building? So it hadn't been sanitized. They hadn't dealt with the mics. It was all these things. And so to act responsibly in my situation, knowing that if I were present, I would have to do things, I ministered with the family in the context of the funeral home. But they made a decision to go into the building that had not been sanitized, had not been properly taken care of. It was my responsibility, knowing the people I would have to be in contact with, to absent myself from that process. It was hard, because but I said, I was with you yesterday. I will not be able to be with you tomorrow. It's like hard choices I had to make. Yeah, but I just heard God say, be responsible.
Be responsible. What other responsible things, Dr. Ball, are you seeing, are you suggesting within your own denomination and within your own church to be responsible? What are some of the alterations that you have had to make to your church services and to your church operations?
All the things that the CDC has instructed us to do. All the things that, and I want to stress that, all the things that the CDC has instructed. Maintain social distancing, wear your mask at all times, ensure that you're taking temperature check for those who are coming in, ensuring that you do some form of survey, right? And making sure that you take care of the members. I think it's critically important. And what I've said to my local congregation is, I would never want to know that I have been a contributor in any way to anyone's becoming ill or, demise. And so I am very, very strict about that, maintaining smaller amount of people, double service if you need to, outdoor service if you need to, online service if you need to, social distancing, get tests regularly. Here are all the places in the city that's getting tested, that's provide testing for you at no cost to you. All the things that the CDC and the medical personnel have instructed us to do, that's what I am advancing. A place where science and faith are together.
Yes, I think we have run out of time. I want to thank both of you for being our guests on Brooklyn 45. So I want to thank you, Bishop Lucas, Bishop Austin Lucas, and I want to thank you, Dr. Roger Ball, for being on Brooklyn 45. And we have to have you back. We are all very concerned about our pastors, because we go to our pastors for help. And if you need help yourselves, then, like you said, it's a two-way street. So thank you very much for being on our program. And now over to Regi.
Throughout history, people of color have boycotted, marched, and protested in order to initiate social and economic change. And we have achieved points of light that shine bright to this very day, like the March on Washington for Jobs and Freedom, the March for Our Lives, the Montgomery bus boycott, the Olympic medals held around the world, the occupation of Wall Street demonstration, and the Million Man March, just to name a few. In recent history, we have seen people of every creed and color stand together for principles that we fought for so long ago, demanding that we are seen and not just heard, looking past the roadblocks and focusing in on the lives that matter, recognizing that we're stronger together. We now stand where everyone else is sitting down. We shout into the darkness instead of weeping through the night. Yeah, we're stronger together and committed to the overall goal of not just a few, but the many, because no weapons formed against us will ever prosper. Stronger together. My name is Regi Brown, and this is Brooklyn 45 TV.
Brooklyn 45 is a 501c3 not-for-profit, and we welcome your support. Check out our website, brooklyn45.com, and feel free to donate or share it with your friends and family. Have any comments or questions? Send them to our Facebook, facebook.com/Brooklyn45TV. If you have any questions or topics you think we should cover next, shoot me an email over at brooklyn45tv@gmail.com. Thank you again for watching.
On behalf of our entire Brooklyn 45 team, I'm Sam Tate.